Hello, today is November 12th, 2020. My name is Brandy Saavedra. I'm interviewing Ariana Picon for the University Library Special Collections and Archives at the University of Texas, Rio Grande Valley, hereafter abbreviated as UTRGV. This project is in partnership with the Voces History Center at the University of Texas at Austin. Please know, Ms. Garcia, that this interview will be placed in the University Library, Special Collections, and Archives at UTRGV and shared with the Voces Oral History Center at the University of Texas at Austin. If there is anything you do not wish to answer or talk about, I will honor your wishes. Also, if there's something you want to talk about, please bring it up and we will talk about it. The University Library Special Collections and Archives will archive your interview along with any other photographs or other documentation you are willing to share. UTRGV University Library will retain copyright and or non-exclusive right to the interview and any other materials you donate to the Special Collections and Archives at UTRGV. Because we are not conducting this interview in person, I need to record you consenting to make sure you agree with our interview procedures before we continue. So I'll ask a series of 6 questions. Please say, yes, I agree, or no, I do not agree after each question. Do you give University Library Special Collections and Archives at UTRGV consent to archive your interview and your materials at the UTRGV University Library?
Yes, I agree.
Do you grant UTRGV University Library Special Collections and Archives rights, title, and interest in copyright over the interview and any materials you provide?
Yes, I agree.
Do you agree to allow UTRGV University Library Special Collections and Archives to post this interview on the internet where it may be viewed by people around the world?
Yes, I agree.
Do you grant the University Library Special Collections and Archives consent to share your Zoom interview with the Voces Oral History Center at the University of Texas at Austin for inclusion of the Voces of Pandemic Oral History mini project, which will include posting the interview on the internet?
Yes, I agree.
As you recall, we previously filed out a pre-interview form. We will use information for the pre-interview form to help in research. The entire form is kept in a secure Voces server at the University of Texas at Austin. Before Voces sends it UTRGV University Library Special Collections and Archives, we would have stripped out any contact information for yourself or any family members so that will not be part of your public file. Your public file will only be accessible at UTRGV University Library. The final 2 questions ask for your consent on what I just described. Do you wish for us to share the rest of your interview in your public file available to researchers at UTRGV University Library Special Collections and Archives?
Yes, I agree.
On occasion, UTRGV Special Collections and Archives and Voces receive requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or your email with journalists?
Yes, I agree.
Thank you for your consent. Your experiences and stories mean a lot to us at UTRGV Special Collections and Archives. I look forward to what you say in your interview questions. I will now ask. All right, Ariana, first, thank you for making some time during the current pandemic to talk about your experiences as a CNA on the COVID floor. Like I said earlier, your stories and experiences shared are valuable to us at UTRGV Special Collections and Archives and the Voces Project. For us at UTRGV Special Collections, we are committed to preserving the stories of Mexican Americans and Latinos from South Texas and the Rio Grande Valley, and those who work closely with those populations. During this COVID-19 pandemic, because you are a healthcare worker who dedicates her time to her community of Edinburgh, Texas, and because you are a daughter, a sister, and a friend who is knowledgeable in the many ways COVID-19 has affected others in your social sphere. I know you have witnessed and experienced important events during this ongoing pandemic. So before I start asking you to share your stories about the life in the pandemic, what are 3 things that remind you of home?
Interesting. My mom's food. I don't know what to say, girl. I'd say our I don't know. This is very silly.
How about things that remind you of the valley in general? Just things that bring the sense
Oh,
of
okay. I
your home.
see your question. I, of course, our food, our culture, our our way of all knowing each other, and even even when I'm not anywhere near home, that hey, like that reminds me of like hey, like even if I'm nowhere near home, if I'm traveling or somewhere, it just makes me feel like I'm welcomed in a place. What else? Um, one more thing, right? Um,
We can
the
continue with the other questions if you'd like.
yes.
Okay, so the first question I want to ask you is, when did you first hear about COVID-19? How did you learn about it? Was it through the radio, the TV, children, social media?
Okay, so I'm not a person that watches many television or radio or anything, but I do remember this specific time where COVID caught my attention, and I was in my unit, and I was at the nurses station, and there was nurses there, and we were all speaking. We were talking over the topic, right? By this time, we were already having shortages of supplies in here at the valley. Even though it hadn't reached yet, we weren't seeing any um, positive cases. But I remember them saying like, "Hey, this COVID thing sounds serious, right?" And I remember thinking like, is it really like it never it's it there's other things that have happened like this before, and the government has been able to stop it, or it's been all avoided, like, and it never reached us. I don't think it'll, and in my mentality, I told myself like it won't reach the valley. We're too small to get impacted by something like this, like, and I was just in some kind of denial. I didn't really think it would affect us. um so yeah.
Going off of that, when did you realize was a moment that it kind of hit you that this was a serious life altering event that was happening?
Right. The moment when they all brought us into work, and we had a short meeting, right? Our director was coming up to us and asking us like, hey, are you willing to take to go into this unit, right? And and I was like, wait, you all never ask us like if we're willing to get floated to a place, you just do it. And I realized that it was that serious because they were asking for our consent to, if we wanted to work there, if we were willing to be exposed. That's when I realized that it was something serious, something that was very contagious, and that was very harmful, that could cause potential harm to ourselves and to our families. That's when I realized, when my director personally came up to me and asked me, hey, like, hey, are you willing to go into the COVID unit, when they normally don't do that?
Over the last few months, what news media or what did you rely on to keep yourself updated of COVID?
Um, I relied more on social media. I know it's kind of silly, but I relied a lot on social media about the news. I followed our local news on the social medias, and that's the only way. That's how I would track it. Like, hey, at first we were like, oh, there's one case, like, oh, it's okay, right? And then I saw that escalated, and it turned from tens to hundreds, and then it turned to thousands. And well, yeah, that's where I was getting my information from, social media.
Can you share with me what you understand about COVID as an infectious disease? What, or on the other hand, like, what are things you don't understand?
Oh, yeah, there's many stuff that I don't understand, right? Because it's there's very little research and a lot of the unknown, right? So like I know when this whole COVID thing started, we were all questioning whether a medication would work or not. And what a little bit that I do know is that this affects someone like in crazy ways. Like pneumonia wouldn't do this, the flu wouldn't do this to a person. Like it's just very, very, very scary, like a very traumatizing and a very intimidating thing to work with, you know. This COVID, they came in with like COVID, right? I don't know all the terms exactly because I'm not a nurse, but for a patient to get a heart attack, for a patient to just stop breathing from like 1 minute he was fine, another he's already coding. This was something that was out of our control. It was almost as if like this virus was too perfect. You know what I mean? Like it was too perfect in killing people, and we didn't know what to do. Like, and I'm pretty sure that I'm not the only one that feels that way. Like it was just something very, very different. Very.
Talking about medications like you brought up, would you take the first COVID-19 vaccine available on the market? As like research has developed and stuff, would you trust taking that?
I would give it time because if it's taken this long to find the you know a vaccine for this, is it really safe? You know, there's questions in the back of my head, you know, like should I really trust this that they're putting into my body? But within time, and I'm pretty sure I would. And even in my work environment, I feel like it would possibly be mandatory to take it as well. So but yes, to your question, I would take it.
Do your family hold the same beliefs as you about COVID? Or are there some family members who take it more seriously or more lightly?
Oh yeah, definitely. Not a lot of my family was a believer of COVID. They were all saying, "Oh no," like us Hispanics say, "No es nada. It's not gonna happen to us. We're too." I don't know. Like I don't know what would pass through our minds or anything, but it was always the mentality like it's not gonna happen to us. It's gonna happen to other people, but not to us. And when it did hit the family, when things started getting closer to home, that's when the realization that this was something that was affecting everyone, no matter of where you lived or your age. It was going to affect anyone, and if you weren't willing to take the fight with COVID, I mean, unfortunately, like many, you know, it could have cost you our lives, you know.
So for these next set of questions, I'd like to talk about how you've seen COVID. Um, have you seen COVID affect family members, your friends, or equal important people within your social spheres because you live in the Rio Grande Valley with a mass population of Latinos? How would you explain the way the people thought of COVID as it began to hit the community? In what ways did they react initially?
Panic. Like I remember when there was a lot of shortages at stores. At the beginning, people were being very precautious, right? I believe like whenever we started seeing a little more and more cases here in the valley, people started being a little more paranoid. I'd say like the very first few months of it, people were taking some sort kind of precautions, yet they were still going out. Yes, they were wearing a mask. Yes, they were wearing a face shield or gloves, but a precaution is also staying home, and that's something that many didn't understand. They were all in a hurry to get food for their family so they can provide while we're going to be at while the stay-at-home orders were like the stay-at-home how can you say it
Stay home orders?
yes, stay-at-home orders were in place, which it never really happened, I believe. um, well, it did, but it wasn't really enforced as much as we would have liked. And yeah.
So going into your personal life, do you believe the values within your home reflected onto the way you reacted to the pandemic?
Yes. um I live with I live I live with my parents, and my parents are a little advanced in age, right? And they have a lot of like the my mom's diabetic with high blood pressure, my dad as well. um I believe that once they saw, and then like once we started to have like a little bit of more knowledge about the virus, my parents right away were telling me like, oh, you have to be careful at work. We wouldn't like for you to get sick. But this whole time I wasn't trying to. I personally, nobody wants to get sick with COVID, right? But the reason I didn't want to have COVID was because I knew that I had to come home, and where else was I gonna quarantine if not within my own home, and I didn't want to bring that virus home to where my parents could possibly get sick.
When the lockdown officially was in place for give or take 2 to 3 weeks initially, what did you see within like the community, both in your hometown and within the Hidalgo County?
uh, I didn't really see a difference. um, I know for a while we were given these papers at work. We were sent emails and told to print them out or always have them on our phone with us, because there's gonna be more police police enforcement, and police were gonna be stopping us in the roads, and even though I always had that prepared, I was never stopped, or neither was my dad on his way to work. Neither one of my coworkers or friends that were um, out during this time. They were never questioned on why they were out at the time they were, or why they were out at all.
You mentioned in our pre-interview that you have relatives who live in Mexico. Did you see the same response to the news of COVID there as you heard the news here?
No, no. In My family members in Mexico were very scared first. Were very scared, but as well they didn't have the precautions. They couldn't take the precautions that we can here. Um, Being in the United States, I feel like it was very there wasn't much order, and that's what caused them to go into panic. I know I had several family members saying like my aunts that are able to come and visit us, they were saying like, can we stay over there with you guys? Like, things, I feel they feared that they weren't safe where they were at, because of not only like the medical um like the medical like attention that they could receive over there in Mexico. They were fearing that if they did catch it, they weren't going to make it because of that. So they wanted to come over here, and they wanted to be safer.
So when the deaths started rising around July and August, did you feel when there was a lack of resources, did it really impact you?
Oh yes, definitely. I'm not gonna say that where I work we were not prepared, but at some point it did get to the point where we were wearing plastic gowns, when we used to wear like these other different kind of gowns that we weren't used to something like that, where we had to wrap bags around our legs because we ran out of shoe covers. It got to the point where we had to wear I'm not it got to the point where we would have to wear how can I say it, the covers for the pillow covers. We had to wrap them around our head because we ran out of bonnets. So if we didn't have our own cap, we would have to wrap a pillow cover around her head, and that was very fun. That was very funny, but it did make it an experience. We had to reuse our N95 mask for a period of a week. You have to sign out every time we would get one, and if we did lose it or it broke or somehow we misplaced it, we would always have to give a reason as to why. We were always questioned, right? And they would kind of hesitate, to give us another one. But yes, we saw a lot of shortage in our equipment that we needed, not only like on our PPE, but in like necessary equipment like PCA lines, like extension, like O2 extensions. We had a lot of shortage in a lot of things. So I believe that could have been prevented, right, in some way, but we all managed.
So, in what ways have you adapted now to protocols when you go shopping or when you go to public places for groceries?
I kind of try to avoid to do that as much as I possibly can. I don't like to go out because I've seen how it affected people, right? So I wouldn't want to be the reason for the spread. But the ways I wear my mask all the time. I try to keep away from as far away from people when I do have to go into the stores, right? Or when someone gets too close to me, I'll just like turn around and go home, go to the next line, just try to avoid that close contact. I've also stopped. Before I used to be a very outgoing person. Now it's more of we kind of have to avoid going out into public places and into those restaurants because I mean we've seen what the consequences were because people were doing that. So I try to avoid that.
Can you share some stories about the struggles your family had in the pandemic?
Oh, of course. I know from the beginning of it was probably around like March or June, when this whole pandemic kind of started blowing up, right? And something it was very sad because how can I say it? From my childhood, I was always very close with my parents and my family, and something that I would always do, even going to school or when I would go to work, I would every morning when I would wake up and right before I went outside and catch the bus, I would kiss my parents, even if they were sleeping. I would kiss them on the cheek, on the forehead, right before I stepped out of the house. And going to work as well, I had to stop doing that because I was put into the COVID unit, and I was afraid that maybe what if I was asymptomatic, or what if I had the virus without knowing, and doing that, kissing, like with just a simple kiss, I could transmit that and possibly cost my parents my life. So, and we all felt it, right? We all kind of felt a little more distant because that was something that we would always do, and it was kind of our little thing, that kind of like started off our day, and it was very sad. And to this day, like it's still sad because I still work at a hospital and I still have contact with COVID patients, and I'm still not able to kiss my parents every morning.
All right. So these next set of questions, I will focus on your stories and experiences as a healthcare worker. So we're gonna transition from talking about your social sphere at home and in your community into more of like your workplace, on the COVID floor and behind the hospital doors. The main emphasis in these questions is to help us see the struggle behind those hospital doors, you know, in an area that became quickly a national hotspot for COVID. So just to get some backstory, how long have you been employed with DHR Health Hospital?
I've been working there for a little over a year.
How did you land your job there?
Um, I always wanted to work in a hospital, right? And previously I was working at a nursing home, and I wanted a little more of a, not of a long-term care kind of work. So I applied for a hospital, and little did I know, like, that I was going to receive a call and get hired there, because it is. I felt kind of flattered because DHR is one of the. It is the largest hospital in the Rio Grande Valley, and it was such an honor whenever I received a call, and it was like, we're interested, like, in you. We'd like to, like, have you join our team, and it's been a great experience since I've started.
All right. In the voice of a healthcare worker, what would you say COVID-19 is? So separating it from the initial thought, your initial reaction, what would you say COVID is in the eyes of a healthcare worker?
It's it's something that takes lives. It's it's something that separates us, that causes a lot of sadness, that makes us feel very lonely, because even patients, they're surrounded by nurses and doctors. At the end of the day, they would they would love for a family member to be there and push them through their battle. And I think it's a very lonely, very lonely experience. um it's many things.
So what are some of your favorite things to do as a CNA before the pandemic? Has any of these things changed since?
Oh, of course. I've always had this, the, like, I always say that it's a little selfish, because working in the medical field, right? I find it a little selfish in my way, because, like, I love doing the bedside care, like the all the activities of the daily living, like helping patients do like the things I would do on a normal basis, right? If they weren't sick. And I love whenever a patient looks up to me and says, "Oh, like, thank you so much. Like, God send me an angel, because I haven't been able to shower myself for weeks because I've been sick." And I feel like that's a little selfish in my way, because, like, it makes me feel kind of good, like, whenever, like, the compliments when my patients tell me, like, you're the person that needed to be here today, because, like, you've been so kind to me, you've helped me a lot. And I think that that's one of the things that I've always enjoyed doing. And till this day, I don't think it's changed. I still love doing what I do, and I still love receiving that from the patients. Uh, and I don't think it's ever going to stop. Like,
Okay. How was your work hours pre-COVID? Do you find
my
yourself more stressed out, anxious? I'm sorry.
uh, my work hours before COVID, I used to work 80 hours on a pay period every 2 weeks, right? But after that, we were asked if we could come in extra days to cover to yeah, to cover a shift, because we were opening new units, we were opening other buildings with COVID patients, and the staff wasn't there wasn't enough staff to go in there and take care of the patients. So we were asked to pick up days, and what used to be a 12-hour shift at a hospital turned into a 13, 14-hour shift, because of just because of the things that we had to do decontaminate and to give report for all these new people that were coming in. We had to walk them. It was like if we were doing all the training process in one day, in, like, not even in one day, in less than an hour, we'd have to tell the people, like, this is the new unit, this is where you find all this stuff, this is where this is at. And we just have to walk them through the whole unit and just give them like it was like if like I can like I'd like to ask you a question. How would you feel if your current job would just you would just come in on your first day and they would tell you like, oh, this is all the equipment, this is how you do this is how you do that, get started.
Overwhelmed.
It's overwhelming, yeah. And that's what made our shifts a little more stressing. It did cause a lot of anxiety because in the middle of a code and a nurse would yell, bring me something, right? Bring me a specific thing, and you didn't know where the materials room was at, so you'd have to run room by room, opening doors, going through stuff, and to bring this piece of equipment that could save a patient's life. So yeah, it was very, very stressing. I had a lot of anxiety. Even till this day, I am currently at the moment, I'm not working. I'm on vacation days that I've been asking for quite a bit of time, because after I stopped working at the COVID unit, well, for a while I did stop. I was very burnt out. I was very tired. Even on my days off, I didn't feel like doing anything. I didn't want to get up because of just the amount that this carried on us. Like it was mentally exhausting, mostly, even physically exhausting. It was very physically exhausting, but mostly very mentally exhausting.
In what ways was it physically exhausting?
Where we were on our feet for all these 12 to 13 to 14 hours, where we were asked to wear PPE that was not proper, where it got to the point where well, like I said earlier, we would have to wear plastic gowns throughout all our shift, from the beginning to the end, throughout the whole shift. And at the end, just so you can give yourself a little bit of like of an image of what we went through. Like if when I would take off my gown, I was drenched in sweat from my scrub top all the way to my knees. If I were to like turn and like twist the scrub top, there would be like, it was just very bad. It was gross, but I mean, it was an experience, a learning experience, and I would do it again, because at the end of the day, we did help a lot. We did what we could, and we helped people. But that's the way. That's a way that I could say that it was very physically exhausting. Not only being on our feet, but having all this equipment on us that we weren't used to, having to wear all this stuff, and it was very very uncomfortable.
And you mentioned the mental exhaustion. What would that pertain to?
Okay, it was very mentally exhausting because we were seeing patients die very, very fast. We would see patients' health deteriorate like very fast, and within days, like where this person came in, like, and they were in ICU status, but they were still okay. And later, 2 days later, when I would come back, they were intubated and fighting for their life. They were on, in that way, because I would see how it would take life. It would take life. It would take life from patients, and it got to the point where we would have to listen to family members of patients say their last goodbyes through a Zoom meeting. I don't know about you or about anyone, but I wouldn't want to say my last goodbyes to my mother, to my father, to my grandparent, to my best friend, through a Zoom meeting. Like what I would love to do would be like hug them, right? This is gonna be my last hug, my last kiss to them, and they weren't able to do that. So that was something that was very mentally exhausting in our part because it was very sad, but yet we had to be very strong for the people, for our patients.
Can you share some stories of your happiest and your saddest moments at work since the pandemic started?
One of my happiest moments, uh, it's it's a sad, and because this patient uh, did have COVID, but she was a pregnant woman, and she came in, and from the very beginning, we were all very scared, right? Because a pregnant woman with COVID, this is very dangerous, right? Um, life, but her kid, right, in her belly, and um, at first she was scared, but that would be one of my happiest moments when I was able to walk her, push her chair out, like push her out of the unit to her car where her family would take her home, because she was no longer COVID positive. And the look in her face when she was very grateful, and um, it was something that I'll never forget, because it was a relief to us, right? That we were able to keep her um, keep her healthy, and she was able to go home to back to her family. Not only her, but her child was also in perfect condition. So it was one of my like happiest moments. Um, and one of my saddest moments would be um, from when this started. Uh, I I was My unit was the first one to get floated there to the COVID unit, like the COVID ward, we would call it. And in the first half of the ward of the COVID unit, there were rooms, but in the back, it was just it was at the, I believe, a 32 bed ward where only curtains would separate patients. And I remember walking in, and I admitted the first person in there, the first patient in there, and I was like, oh wow. I was like, I really pray to God that this place does not fill up. This ward back here, this thing that just separates patients by curtains. I really I really hope this doesn't fill up. And and it was very sad when I I finished my last day on at work. When I admitted that first lady at work at the unit in the back. She was the only patient, one patient, and we were using it as a medical unit where it was just patients that are okay. They're not intubated. They're not anything. They're just on regular oxygen. And I had my break, and I was so happy. It was my Friday. I had admitted that patient. She was the last patient. I was about to leave, and I come back. I leave. I had a 4-day break, which I was very grateful for. But when I did come back, that ward, that place, that where I had left, and it was only one patient, was filled with patients on artificial breathing, that were intubated and that were all fighting for their life. I remember that being my saddest moment, because it was something that I prayed for. I was like, please God, don't let this place fill up. Please God, don't let this place fill up. And that's where a lot happened. It's a lot happens, and it's still continuing to happen, but we're all just praying that this can soon go away.
Did you initially think it would affect your workplace as much as it did?
Definitely not. Like in the beginning, when you asked me where I heard it, I didn't think it was gonna reach us, and I said if it does, I don't think it's gonna be too serious. If it does, they're gonna find a cure to it, and it's gonna just disappear. But never did I think that it was gonna affect us this to this extent, because it was where there was a 50-bed unit, we turned it into 100 beds, and it was just overflowing. So I didn't think that would ever happen, especially here.
How has this affected you personally and professionally as you want to move into a different nursing area, a career?
It it has affected me in a way that not, how can I say it? It didn't affect me. It affected me in many negative ways, but I'd like to see the positive in many things. But um, it has helped me be more compassionate with people, be more grateful for what I do have now, and I looking forward to going further in my nursing career. Um, it hasn't affected me much, because I still want to do that. I still want to pursue that dream of becoming a nurse and continuing to help, you know, and
Right. So was there a moment when someone you personally knew walked into the hospital? If so, how did you react?
yes, actually, that's when I knew it was hitting home and when it was getting more and more serious, because people that I personally knew, people that I would go to church with, my neighbor, my neighbor down the road was at the hospital as well. But I remember my duty that day was to help our unit clerk, and she asked me to update a few charts, and I was going through the charts. I was going through the list of census, and I started to see. I saw a name that I was familiar with, and I was like, "Wait, I know her." And I kind of like, maybe it's not being in denial, right? It's not someone that I know, right? In my head, I was like, it's not her. I went to her room and I was like, oh my God, it's someone that I know. Like, it's someone that I go to church with. It's someone who has children, who has a family. And um it happened in many occasions. I've not She wasn't the only one. There was many people that I knew that were admitted to the hospital, and a handful that didn't make it out. uh,
I saw a news article reporting that there were ants found within the COVID-19 units, crawling on patients and on equipment. What did you hear about this initially?
well, I heard what you heard, um, that there was ants on a patient who was intubated. That's very unacceptable. But this is an embarrassment not only to me as a healthcare professional, but it should be an embarrassment to everyone working there, because it shouldn't have happened. It should have that's a human being, you know, and we don't treat someone like that, even if it happened within minutes. Um, it shouldn't have happened, and I wouldn't want to comment on anything else further.
Some reports claimed that the bodies were not being handled well after the deaths. Uh, does this give us insight into the lack of help or the staffing issues, especially during the global crisis that was happening?
We were definitely having issues with the staffing. Yes, we were. I could say that, but with bodies not being handled properly, I can say that we did what we could, because of the amount of death of the high rates of deaths that we were having. But everything that could have been possibly done was done.
Did this reflect on the way the hospital was getting aid from the government officials? The resources that that the DHR hospital was receiving?
Um, can you ask me that question again?
Of course. So does this reflect onto how the government, the Texas government, was helping the DHR hospital during this global crisis, especially here in the hotspot of Edinburgh and McAllen?
Okay. I think there could have been way much more help, and things could have been done differently. But like I said before, everything that was in our power, in the power, like, everything that we were delegated to do, we did with the most care and with the most professionalism. But about that, I don't have anything to add to that.
What did your administration do to help address both the needs of the patients and the nursing staff as of you as a worker?
Okay, there we were given access to psychologist, I believe, as someone that can help us through this. We were given every once in a while a break from working there and being completely exhausted. They would try to rotate us around as much as they could, so we can like have a break, right? We were constantly just kind of like going from one unit to another. We were rotated to a different unit, maybe where we could do things differently, or it wasn't the same amount of stress, I can say. So I believe that that's what, in a way, they helped in that way.
Did your hospital ever run out of or have low levels of PPE at any point during the pandemic? And what sort of PPE are you responsible for bringing to work? Or do you have to pay out of pocket? Or is there any things that you have to bring?
Oh, no. We don't bring anything. Well, the only thing I would take at most, I would take a surgical cap, a cloth surgical cap, because at some point we did run out of bonnets of the hair covers. So I would take one of those, just in case if that day we weren't gonna have any, I had some kind of protection. But we did have a shortage of PPE equipment, from gowns to hair bonnets to masks and N95s, to shoe covers. We were also provided with scrubs, and we were also short on that as well. This was a little, not many hospitals do this, but our hospital, the hospital I work with, they added that as well. They threw that in to help us be better protected, so we wouldn't bring our contaminated scrubs back home. We were given the opportunity to change and not bring it home.
How did this make you feel as you began to see the struggle and need for governmental aid and the lack of it?
When our hospital had to close down a few units in the main hospital in order to provide nursing staff in the COVID unit, that's when we all knew, like, it's too much. We need help. We need more nurses. We need the hospital, the government, anybody to send us help. We were all desperate because as a CNA, I know we do have a lot of backbreaking work, but our work isn't anything compared to a nurse's. And for them to have unsafe patient to nurse ratios was very scary. And the hospital did as much as they could to keep us staffed. But I know that we always asked for more help, and we were given the help later on.
So, did DHR receive some travel medics to help? How
Oh
many?
yes.
Where did they come from? What were your thoughts?
Oh, okay. Yes, we did receive travel nurses. Not only nurses, there was respiratory technician, therapist. I'm sorry, respiratory therapist. There was uh, EMTs. Yes, EMTs. There was monitor techs. There was CNAs. There was ER techs. And where they came from, they came all over the place. I had the privilege of becoming close with a few of the travel staff, and many are. Oh,
It says that your video camera is off. All right. Did DHR receive some travel medics to help? How many? Where did they come from? What were your thoughts?
uh, we definitely did need the help, so we were all very grateful for it. We took what we could, what we were given. You know, we were all very happy that we received a lot of help. These nurses and these technicians, the CNAs, the respiratory therapists that came from all over the place. It was a beautiful thing because like people from different cultures, people from different worlds, you know, that never been to the valley came here, and we all worked together to keep patients safe and to provide the medical attention that they needed.
So now I'm gonna ask you some questions about, public concerns. So are you concerned about the effectiveness of social distancing?
The Yes, yes, because at some point I wouldn't want our government to say, "Oh, just keep 6 feet away and you'll be fine. You don't have to wear the mask." You know, I think it's in some way it is effective, but we can all try to avoid going out as much as we can, or we should. Yeah. Sorry.
All right. Have you had to take on any extra work duties because of COVID?
Yes. Okay. So previously, I don't know if I mentioned, um, I worked with pediatrics. I currently work in a pediatric intensive care unit, and when I was, what I do there is CNA work and the minimal clerking, which I mean is just putting getting face sheets and labels and putting them in a binder, and that's about it. So something that we did have to learn in a matter of weeks was how to receive report for a patient coming in from ER being um, transferred to our unit, how to be in contact with bed board, how to make appointments, how to page doctors when there was a code blue. So all this was very different for us. Um, I remember my first code blue there in the COVID unit. A nurse yelled, not in a rude way, but she yelled at me saying like, "Call Doctor whatever," right? And let him know that his patient's coding, have him come in, like. And this whole time I was thinking in my head, how in the world do you page a doctor through a computer? I never knew how to do that, so it was very intimidating when I was asked to do all this stuff, or I was expected to know all this stuff. And in reality, like, it was a learning process, a very fast learning process, because we had to pick up on all these things very fast. And I'm I'm thankful for it actually, because now I'm a little more educated about that. And now if I'm asked to page a doctor, I'm not gonna panic and call everyone.
All right. So, what kind of policies has your hospital enforced since COVID?
um, we we have to, well, there's no visitors first off, and no sorry, there's no visiting is restricted, only for pediatric patients and laboring mothers. They allow one visitor. It's for the laboring mothers, it's the father, and for pediatrics it would be a parent, right? Or the guardian. And some other precautions that we've taken, we were they closed down our cafeterias at some point, and if we needed food that day, we would have to call in, and they would have it delivered to us. So we wouldn't cause any crowding at the cafeteria and risk social, interaction. um, they also have us every morning. They take our temperatures and they ask us a series of questions, which is all done. The questions are done every online every morning. So every morning that I walk into work, I have to pull out my phone and answer 5 to 6 questions, which is like, have you had any fevers or coughs, or have you been feeling sick lately, etc. Right? And so that's a few things that they've done. I can't really name them all at the top of my head, but they've done quite a few things to keep us safe.
How has the hospital how has the hospital been impacted financially because of the pandemic?
Um, I I know that I can't really speak much about this because I'm not, an administrator or anyone that had of higher power, right? But I know they had to have some kind of financial, struggle, because we weren't properly equipped. So in a matter of weeks, they had to purchase um, hundreds of ventilators, uh, HEPA filters, and these aren't things that cost, that cost a few dollars, right? These are things that are pretty sure that cost hundreds, and and even with all other equipment, I'm pretty sure that that was one of the things that they were struck with.
Are some units like elective surgeries struggling?
I know that for some point in our hospital, they stopped doing surgeries that they could, like for example, like knee surgery, or a replacement of something. They, like surgeries that could be held, they stopped doing those because they were focusing more on COVID patients. And now I know that they've resumed them, but they're taking every precaution that they can to do that. Like for example, if someone's getting a surgery, they do a COVID test 2 days prior them getting the surgery, and I believe they also get a rapid test on the day of the surgeries.
Are you satisfied with the local response to COVID in Edinburgh and Hidalgo County?
Um, I personally would say no, because many places that aren't um, what's that aren't needed, that aren't essential, are open. Like for example, bars don't need to be open. Uh, Family restaurants don't need to be open at the moment as well, either. The uh, places like those don't need to be open, and I think that they could have done something to close those down and avoid the spread. And yet it wasn't done. It wasn't enforced here.
So we're already wrapping up doing the final questions, the next steps of COVID. So, another question would be: are you satisfied with the state response to COVID, led by Governor Abbott?
Um, no, no, we could have done so much more to prevent all of this from happening, and someone with authority like him could have done something very different, you know. So I'm not satisfied, but I'm we, I can't say he did everything he could or he should have, but I believe that there's more precautions that he could have, more things that could have been introduced to help us from spreading this virus.
Are you satisfied with the national response to COVID-19 led by President Trump and his administration in 2020?
Definitely not, uh, because years ago when the Ebola virus did happen, I know it was probably like 2009, 2010 when it happened. I was very young. I remember people were panicking over one person in the entire United States being positive for the Ebola virus, or yeah, virus, and people were already causing panic, and yet it was only one person with when thousands of hundreds of people were infected and were dying, and yet people weren't taking this seriously, because I believe that, or the administration wasn't really taking it as serious as it should have. Like, for example, calling it a hoax was something that should have never been done, because people believed it, you know, and they said, oh, it's a hoax, it's not real, it's something that is just being made up, right? When it really wasn't, and it was really affecting us.
I'm sorry about that. If you had the power to respond to COVID-19, what would you do differently, if anything?
I would close down borders. I would close down um, all the non-essential places. I would stop. I would even close down, even to the extent of closing down airports, because at this point we really don't need any kind of traveling, because that was one of the ways that it was mostly spread, traveling from place to place. Uh, Places like an airport, places like bus stations, places like bars, places um, like even our supermarkets. But I know that that is something essential. I believe that there could have been more precautions that they could have taken as well, like allowing a lot of people being out in lines. That's still more people, that, you know, that's still a lot of people in one place. And I'm pretty sure people got affected there, so I would change that.
This is a special year in our national democracy because it's a presidential voting year. Did you vote? And if so, did you notice or do anything different because of COVID-19 pandemic?
Okay, so I'm unable to vote because I have DACA, and however, I did ask a lot of my friends, and I told them, and I encouraged them to vote, and to give out their opinion on that on our next president, right? Because we do need a change, and even though I wasn't just there.
Is there anything else you would like to share with me about your experiences with COVID-19 that I have not asked about? So this is a
uh,
freebie.
a freebie, something I can say. Yeah, there's a lot of story. I could tell you a story that impacted me a lot. Just something that can maybe someone that's going to listen to this um, this impacted people so much that um, with the whole restriction in hospitals where families couldn't come by and show their support for the sick, for their family members, the people, the patients, the ones that were sick, it got so lonely for them that they would ask us, the healthcare professionals, anyone, even if it was a housekeeper. They had so much. How can I say? They had a really strong. We all were very strong working together. I remember when a patient came in. I went into a patient's room, and it was an older lady, right? And she asked me. She said, she was like, "Come here." And I got closer to her, and she said, she grabbed my hand, and she held it for a while, and she told me, can you say a prayer with me?" And she said, "You don't have to say anything." She was like, "I just want someone here while I pray." And of course, I accepted, right? I said, "Yeah, of course." And I held her hand as she prayed, and it just shows like how lonely it got and how desperate they needed someone there with them. Um, and this was a woman who later on told me that she wasn't taking any precautions, and she was going out, and she didn't think that it would happen to her, but the spread was out there, the virus was out there, and it got to her. And she was just very she regretted everything. She really regretted that she was part of the spread. She said that even when she knew she was positive, she was still going out and she was crying. In her prayer, she said she was asking for forgiveness because she was afraid that her recklessness was causing someone else's life. And
I did want to thank you a lot for sharing your stories today, for sharing your experiences as both a daughter, um, a granddaughter, a daughter, a friend, as a healthcare professional, someone who works in the field, someone who interacts with people on a daily basis. And I want to thank you personally for, contributing to this historical event, something that will help raise awareness, raise lightness into, especially here in the Rio Grande Valley. So thank you on behalf of the University Library Special Collections and Archives at UTRGV, and on the behalf of Voces of Pandemic. It's been a pleasure meeting you.
likewise, thank you so much.